We are continuing with our topic, hypovolemic shock. We are going to see part 2. Okay, so we are going to answer 2 questions. We are going to see the complications and we are going to answer the question of treatment and prevention. The hypovolemic shock affects mainly 2 organs, as we saw. It does affect the whole body, but when the cardiovascular system is affected and the brain, then the whole body is affected. So what are the consequences? How does hypovolemia cause or complicate into a serious condition of the body? So blood carries oxygen. That's what we know. It carries oxygen, other essential substances and nutrients that need to reach all the tissues of the body. When there is a heavy bleeding, or there is not enough fluid in the body, in the vessels, then it will lead to shock. Once the body loses those substances, it will try the best to replace them, but it is not enough in the very short time. So it will lead to symptoms of shock, okay, before anything is done by the body itself. So how does it go? Hypovolemia will lead to low blood pressure. Low blood pressure, and the cells will now suffer from shortage of nutrients, oxygen, and they will get dehydrated. So normally the tissues of the body, the cells, they use oxygen. In the absence of oxygen, now they will go to plan B, where they have to work now without oxygen. That's what we call anaerobic metabolism. So the absence of oxygen now will create acid in the body. So the production of acid now, acid we know, acid will burn. Acid will start causing a disaster in the body, starting on the brain. Now, if the acid is too much, what we call acidosis, become more than the bearable amount of the body, then it will lead to death. That's the greatest complication of hypovolemia. Without forgetting organ failure, where the kidneys will shut down everything. Okay. How do we treat it and how can we prevent it? Once you see a patient bleeding, whether in the hospital or whether outside, you need to do your best to stop the bleeding or stop the fluid loss. Try to stabilize the blood volume in the level, the level that is acceptable. That's what you need to aim for. Okay. Now, once now you are at the accident site, you try your best to initiate appropriate treatment on the field. You need to call for help because you cannot do it alone. You call for help. Then you work as a team to help the patient. Try to organize a transport so that the patient is taken as soon as possible where the management can be done in full. Then if there is a bleeding, you need to apply a direct pressure on the bleeding and put a bandage around it so that you minimize the bleeding. So then you prevent further injuries. Remember, the neck particularly. The neck can be a site where the fractures are mostly accounted. So you need to stabilize the neck to prevent more injuries. So what do? You take your bandage, you roll around on the bleeding wound. You tie it until the bleeding is stopped, minimized. We spoke about cervical immobilization. Remember, the neck with these bones has the wires that are from the nervous system, the one which help to feel sensation, controls the organs, which gives command to organs to work. If now there is a fracture and it is not immobilized, these bones can cut these wires. These can cut these nerves, okay? And once they are cut, then it will compromise. The other organs will stop working, whether the heart, whether the lung, or any other organ. So this needs to be well immobilized. This is an example of how it was immobilized well, but there are many ways of immobilizing, not necessarily using this instrument. But the bottom line, the neck need to be immobilized always, okay? Now the patient should be on a stretcher, very flat, that's not going to be moving. As you can see, the neck well mobilized, being prepared to go on a flat stretcher to be transported immediately to the hospital. If there is internal bleeding, you are in the hospital, use your catheter to stop bleeding. It has a balloon that you need to inflate. It will be having indicators on how far to go, and another balloon which would be stopping the bleeding from the esophagus. You can see them here. And this is a very important measure to take and until the surgeons arrive to assist this patient. You are on the accident zone, there is a bleeding, it's a massive. Try your best to use anything that you can find to tie around, particularly on a part called proximal. Okay, proximal, the one which is near the heart, so that the part that is bleeding does not receive blood again to get lost. Okay, vaginal bleeding, particularly miscarriages, they cause a lot of hypovolemia because the bleeding is profuse and continuous until this product is removed. It is removed out because the miscarriage took place, but they are retained product inside. You can see them when they do sonar, they are big. It's a lot inside. It's a lot. This is a muscle. Now, once they are removed, now it will look like this. So that's what is needed. So the patient needs to be helped as soon as possible. You transport the patient as soon as possible. And when the patient arrives in the hospital, the healthcare workers don't hesitate to give Pitocin, as long as it is what? Incomplete miscarriage. Give Pitocin, there is no problem, because it will help to contract this uterus meanwhile until these products are removed. So if you are outside the hospital, do your best to transport the patient to hospital as soon as possible. If there is a blunt trauma, the lungs, before the blood is filled in the thorax and compromise the heart, that can cause cardiac arrest, the heart to stop, put a drain. You put a drain until the cardiothoracic surgeon arrives and assists. Okay, now we are talking still about the blunt trauma. We have seen many cases where the spleen ruptures, it continues to bleed. Do your best to put IV line on both arms, large bore. You give enough fluid, blood expanders like a Volven, and make sure that the patient is prepared. Prepare blood because you don't know how it can go. Prepare blood for transfusion. And when the surgeon comes, eventually will be able to identify where the bleeding is, will stop it, then the patient will recover. Okay, the blood have helped many patients, and blood expanders, and while the surgeons are busy helping cutting the part which is bleeding and repairing, then this need to be given as well. We need to thank very much people who are involved in the emergency medicine, the surgeons, the supporting team. They have helped many patients. They are helping many today, and they are still helping even for the future. We need to thank them so much, and we need to support them. So thank you very much. We will continue our health education and health promotion.